Bonjour à tous, bienvenue à cette conférence.
Hello, everyone. Welcome to this press conference. We have with us three ministers today who will be speaking. The Minister of Public Safety, Marco Mendocino, the Minister of Transport, Omar Al-Gabra, and the Minister of Health, Minister Duclos. We also have Dr. Tam and Dr. New from the PHAC with us to respond to your questions if needed.
Statements from the ministers.
Bonjour tout le monde. Good afternoon, everyone. Je tiens tout d'abord à...
First, I want to recognize and acknowledge that we are gathered on traditional Algonquin Anishinaabe territory. I'm very pleased to be here with you today with my colleagues, the Honorable Omar Al-Gabra, Minister of Transport, the Honorable Marco Mendicino, Minister of Public Safety, Dr. Tam, and Dr. New, who are joining us virtually.
There today, there's been a lot in the news recently about COVID-19, and we want to provide an update to you Canadians on what we know about the situation and what we are doing to respond to it. Dr. Tam and Dr. New will provide soon further remarks on the global epidemiological situation. But for now, let me focus on our response. I'll be speaking about three immediate measures that we're announcing and implementing today.
First, we will be adding 3 countries to the list of 7 countries we currently have that we spoke about last Friday. These 3 countries are Egypt, Malawi, and Nigeria. As you'll remember, the foreign nationals from these 7 countries and now from these 10 countries, these foreign nationals who have been to those countries will not be able to enter Canada if they have been to those countries over the past 2 weeks. Also, Canadians and permanent residents, as well as all of those who have the right to return to Canada, who have transited through these 10 countries over the past 2 weeks, will, when they arrive to Canada, quarantine. They will have to be tested at the airport and await the results of their tests before exiting quarantine. That is for Canadians and permanent residents who are vaccinated. Those who are unvaccinated will follow the current measures for all countries. That is, they will be tested on day 1, quarantine for 14 days, and be tested again on day 8.
We are announcing today is that all air travelers coming from outside Canada, apart from the United States, will now need to be tested at the airport in which they are landing in Canada, whether they are vaccinated or unvaccinated. They will then need to isolate themselves until they get the result of their test. Obviously, those that come to Canada and are not vaccinated from anywhere in the world need to do a quarantine of 14 days, as it has always been the case, and do a test both on day 1 and on day 8. The third measure is, as we've prepared for a possible extension of that last measure to all travelers by land and by air coming from the United States, we will be working with provinces and territories to see how that could be done. We don't know if it would need to be done, or whether it could be done if the situation evolves and requires such a policy to be implemented. And on that, I will be having a meeting with all of my provincial and territorial colleagues in about 2 hours from now to share those measures and to see how we can prepare for other eventualities.
I'd like to finish with a series of remarks, additional remarks. The first is that we are asking the National Advisory Committee on Immunization, the NACI, to quickly provide to the Canadian government up-to-date directives on the use of boosters in the context of the new Omicron variant.
This measure, this call that we are making is to ask NACI to provide quick guidance on whether we should revise national standards, national attitudes and actions on the use of boosters across Canada in the context of the new Omicron variant. Now, let us also remind Canadians that those rules have always changed over the last 20 months and change and will continue to change as the situation evolves. So this is what we are doing today. It may well be that as we gain time, we find that the new variant is of less concern than what some experts might be fearing, but the situation might also evolve differently. So we're reminding Canadians that travel rules and border rules in particular can always change, and that involves both testing and quarantine measures, and we will be watching the situation, as all Canadians will do, over the next days and weeks.
I also want to remind Canadians that today, November 30th, we are implementing the directive requiring all travelers, air or rail travelers within Canada and coming to Canada must be vaccinated. This is an excellent measure that is very relevant and comes at the right moment in the context of this new variant. An additional remark. Yesterday, the health ministers of G7 countries gathered. It was a very important meeting, and we recognized how important it was to share information during these uncertain and rapidly changing times with the Omicron variant. We have agreed to continue to share reliable information transparently on a daily basis on the situations in our countries. And we also talked about the information we could gain from other countries. And publicly, we recognized, I want to say publicly, that we recognized the transparency that South Africa has shown over the past week. This has been difficult for South Africa and for other countries that have seen more cases of Omicron.
It is absolutely essential if we want to maintain the efficiency of our public health measures, including travel and border measures, but also maintain the ability to be confident that we are going to keep working internationally in a strong and collaborative manner. Finally, a reminder that what is most important, as Dr. Tam and Dr. New will probably remind us in a moment, what is most important in the context of COVID-19 is the application of public health measures and vaccination for all Canadians. These are the measures that make a difference when it comes to the biggest source of COVID-19 challenges, which is community transmission. So we know it's difficult for all Canadians, but we know that all Canadians see that there is hope. There has always been hope as we successfully in Canada, compared to many other countries, go through the crisis in better ways, just both from the economic side, but also from the health side. I was reminded recently by PHAC officials that if Canadians and their governments had acted in the same manner as we saw in the United States, we would have seen in Canada 60,000 more people dying of COVID-19. So Canadians can be proud of the fact that we have worked together. We've been supporting each other, governments alike, and because of that, we will go through this level of uncertainty in the best possible manner. So with this, I will now turn to Minister Alghabra.
Merci, Jean-Yves.
Thank you, Jean-Yves.
Hello, everyone. Bonjour à tous. As we've been saying from the start, the COVID-19 pandemic can change rapidly. And when it does, our government continues to take unprecedented action to protect the health and safety of all Canadians by introducing measures to prevent COVID-19 and new variants of the various from being introduced and spread in Canada. We already have implemented layers of protective measures at our borders, including vaccination requirements, pre-departure PCR testing, and mandatory random testing. Today, to confront the Omicron challenge, we are taking additional action to prevent further importation and spread. Canadians and permanent residents who have been to any of the 10 countries that Minister Duclos listed, even those who are fully vaccinated, must be tested before entering Canada. Starting tonight, these tests cannot have been administered in any of the countries the minister named. This means that Canadians will need to stop and obtain valid results in a third country before entering Canada. Upon entering Canada, these travelers with a right of entry will be tested again and required to wait in a designated quarantine facility until the result of their day one test result is known. If the test result is negative, vaccinated travelers can then follow their quarantine plan and isolate until they receive results of day 8 test. Unvaccinated travelers must remain in the designated quarantine facility for their entire quarantine period. These testing measures will allow us to assess the evolving situation and determine any additional and appropriate measures. Notre priorité.
Our priority is to protect the health of Canadians.
Vaccination is one of our best tools to reduce the spread of COVID-19 and its variants. That's why we've put in place a mandatory vaccination requirement for travelers boarding planes and trains in Canada. And as of today, passengers flying on domestic, transborder, or international flights departing from Canada and passengers on Via Rail and the Rocky Mountaineer trains must be fully vaccinated to board with very few exceptions. À partir d'aujourd'hui,
starting today, travelers will have to be vaccinated.
I want to repeat what Minister Duclos said. I want to ask all Canadians to remain cautious and prudent. The pandemic is not over. To get vaccinated, to follow public health advice, and if they're thinking about traveling, to recognize that travel measures could change at any moment. Our government's top priority is protecting Canadians' health and safety, and our response to the COVID-19 pandemic is guided by the latest science and research. Thank you very much. Merci. And now I'll pass the mic to Minister Medicino.
Bon après-midi, tout le monde.
Hello, everyone.
Ministers Duclos and Alghabra for your updates. Keeping Canadians safe remains our absolute top priority. And as we continue to hear and learn of reports of the new variant of the virus, we have to double down on keeping ourselves and our loved ones safe. That includes following the latest public health measures and making sure we are as protected as possible by getting the vaccine. I want to thank all Canadians who continue to book their shots and receive them, including some adults now for a third dose, and many of our children under 12 who are now eligible. You're doing yourselves, your families, friends, and caring citizens a great service. With respect to Omicron and other variants of concern, we continue to take the strongest possible measures based on the latest scientific evidence and advice in concert with all of our partners. Last week, we quickly announced and implemented new measures at our borders and beyond in response to the Omicron variant, and we are making further precautionary adjustments again today as the situation evolves. As my colleagues have mentioned, those measures will work to slow down possible importations of the Omicron variant of concern. We are also working quickly with provinces and territories to determine how we could expand testing capacity to include all travelers from all countries, including the United States, from both land and air, if needed in the future. Canada's border service officers have been on the front line since the beginning of the pandemic, have done exemplary work in keeping Canadians safe, and I want to take a moment to thank all of them for their extraordinary and tireless work as we continue to manage the pandemic. They will continue to perform admirably and help ensure that these measures are followed. I would also like to remind all travelers, Canadians and foreign nationals who travel by land, air, or water for long or short trips to submit your health and travel information in the free ArriveCan app or website before arriving in Canada. It is mandatory. Foreign national travelers who don't submit their information through ArriveCan may be denied entry into Canada. Canadians who don't submit their information via ArriveCan won't be eligible for exemptions and may face additional delays at the border, and they may be subject to fines as well. I want to thank all travelers for their collaboration and patience as these new changes may increase delays at the border in the coming days and weeks. Our border service officers will never compromise the health and safety of Canadians for the sake of border wait times. We are all monitoring the public health situation in Canada and around the world together in real time, and we will continue to adapt health and border measures as needed. In closing, we say to everyone, get vaccinated. Follow the public health care measures which have been put in place. Continue to follow the measures that we have put in place at the border because they are there for your protection, your safety, and indeed the safety and protection of all Canadians. Thank you. Merci.
Merci beaucoup, Marc.
Thank you very much, Marco. So I believe to gain some time, the two doctors will not be speaking right away, but they will respond and answer any questions that you may have on the epidemiological situation and on the more technical aspects of the possible impacts of the Omicron variant on virulence, transmissibility, and the effects of the vaccines. So I believe we are ready to move to questions.
Engagement. We have approximately 45 minutes for questions. We'll start off in the room, priority to questions in the room. And then if we have some time, we'll go to the phone lines. Je me rappelle une question.
One question, one follow-up question, and we agreed that we will not be having interpretation in this room during press conferences.
Monsieur Duclos, j'aurais une question pour vous.
I have a question. Why these three countries in particular, Mr. Duclos, and do you not fear that these countries that are put on our no-fly list will be less forthcoming in sharing medical information in future, for example, South Africa? Thank you for this excellent question. Answer from Minister Duclos. Why these three countries? Why the new measures regarding mandatory testing when arriving in the country? Why these countries? Well, because based on the information we have from the Public Health Agency of Canada, we have our experts here with us today. There are concerns. Well, there is an issue of transparency. It is not bad faith. It's really an issue of capacity. The three countries, in addition to the other ones that were mentioned earlier, have more difficulty measuring what is happening within their borders. It is therefore more difficult to use the multiple layers of protection that are traditional that would allow people who were in those countries to enter Canada. So it's not based on nationality at all. It is really based on who has transited through those countries. For example, somebody from France who went through Egypt last week, who wishes to come to Canada, will be treated the same way as somebody from Egypt or from Nigeria trying to come to Canada if they've been to one of those 10 countries in the past 2 weeks. Now, regarding whether this provides incentives of any kind for countries to work together, well, the answer is that we must effectively do more to ensure international cooperation. Between the G7 country health ministers yesterday, we agreed to help some of these countries that want to be more transparent, but who have a difficult time being more transparent because they don't have the required information. We also talked about the issue that now we often see that there are not necessarily enough vaccine doses, but there is also problems that we are seeing in administering those doses. We are looking within the G7 countries how we could help provide more specific help, human resources, equipment, for example, to help these countries administer vaccines more quickly and effectively. Question. Dr. New, did you have something to add? Yes, I'd like to add something on the technical side from the perspective of public health. As Minister Duclos indicated, it really is an issue of epidemiology. In some countries, there is clear information that there is community transmission. We see that travelers who have come back to Canada who went through those countries may have been exposed to community transmission. But we really have to also thank, I think, South Africa for having the capacity to detect this new variant and to tell the world about it. So I think that with the measures, with our border measures, it really is just to give us more time to better understand the new variant. There are three main issues. Is it more transmissible? Does it lead to more severe health consequences? And is there an impact on vaccine efficiency? We don't have those answers yet, but the scientists across the world are working very closely together to find those answers. So for now, these measures are really just to slow down the propagation of the virus. We can't close down our borders because the virus has already arrived here and in many other countries. This is a measure to gain time in order to have a better understanding of the virus and have a better understanding of how to adapt, what next steps to take, perhaps change our approach. I'd like to highlight another point that Minister Duclos already mentioned. We already have good protection here, good vaccine coverage. The predominant variants in Canada right now, or the variant right now, is the Delta variant, and the vaccines are quite effective against it. So again, it's important to stress how useful it is to get vaccinated, how important, and we have very clear evidence showing at a population level how measures such as wearing masks, avoiding gathering inside, being socially distanced are good measures, good ventilation as well. People are moving indoors, so that is very important. So those are all important measures to continue to apply. It is also important to continue to follow local health authority directives, which are based on the epidemiology, and that's how we are going to continue to react to COVID-19 and this new variant as well. Thank you. Follow-up question. The WHO has asked for calm, has called for calm and called for an end to brutal measures such as closing down borders. Do you think Canada is one of those countries that those comments were aimed at? Answer, well, I think we are doing things right in Canada from the beginning of the pandemic. We can always do better, of course, but I think we have done very well. And this is something that Canadians have to know, that they have been working hard as well. We are working closely with our foreign partners as well. So we are in a very specific situation. We already have solid protective layers from the beginning of the pandemic, including border measures. But in this case, Public Health Canada believes that the PHAC rather believes that these additional layers will help slow down the spread of the Omicron variant.
Yeah, this first one's from Minister Alghabra. We're hearing a lot of reports, albeit anecdotal, about travelers flying currently who aren't being asked for their vaccine proof. They're going through all the necessary checks, but no one is actually asking for their proof. Are you comfortable with the rate at which airlines are enforcing this policy?
Thanks for the question. We've announced a vaccine mandate, a requirement of all travelers on planes and trains last August. We then campaigned on it in the last election. And when we formed government, again, we announced that the creation of a two-phase approach for this mandate. Phase one was October 30th, and we granted some grace period for this month, including the allowance of PCR test as a substitute for not being vaccinated. And part of the grace period is given some time to operators and airlines to prepare their systems for checking of all proof of vaccination of all travelers. And what had happened between October 30th and today, we had system of random checks. As of today, all passengers will be checked for proof of vaccination.
And then, Minister Duclos, on the NACI, advice to NACI on the booster shots, are you looking at them to reevaluate their advice on booster shots or change it? Do you think we may need boosters earlier than perhaps they'd suggested?
That's right. We're asking for relatively quick advice, renewed advice on boosters. I know that we know that Canadians are asking increasingly about whether they should and whether and how that should be done, receive boosters. And that question is obviously of greater importance now with the new variant. So we are explicitly asking NACI to come up quickly with a revised view on where and how and to whom these boosters should be administered.
Hi there. My question is for Minister Duclos. Just recently, the CMA put out a report saying there have been thousands of excess deaths due to delayed surgeries and procedures because of COVID-19 complications in hospitals, and saying it would cost about $1.3 billion to address these backlogs by June. Are you looking at increasing the transfers to the provinces to try to best address these backlogs in the hardest hit areas?
Well, thank you. And our own estimate, which is, of course, dependent on the information that we receive from provinces and territories, is that there would be approximately 780,000 delayed surgeries in Canada at this particular time. Our understanding is that those delays are being reduced slowly because the pandemic is relatively under greater control now than it used to be, say, in a few weeks or a few months ago. This being said, there's a lot of work to do to protect the health of Canadians. Now, one more good news is that we've promised in the campaigns very significant and quick investments to address things like backlogs in surgeries, but also access to primary care, long-term care, home care, mental health care. So we have a total of $25 billion that we want to invest quickly in support to the priorities of provinces and territories. And we know that one of these priorities is exactly that, to handle the backlogs in surgeries.
And this morning we had the CEO of Moderna saying he's worried that the current vaccines may not be as effective against the Omicron variant as we've seen with past variants. With that in mind, can you give us an update on what you've heard latest from Health Canada on reviewing some of the antivirals from companies like Merck and Pfizer? Just what the status is there, and has Canada begun purchasing any of these pills?
Well, on the last question, I can tell you that we have very strong and very good procurement contracts with, seven, as you might remember, seven companies, four of which we already have the ability to administer doses from. So it's a portfolio that from the start we knew was going to be very strong, and it did show that we had made not we as politicians, but experts, made the right choice. And we have 420 million doses on order, and therefore sufficiently so to give Canadians the vaccines that they need. Now, on your first question, I would prefer to turn to Dr. New, because it's an issue which Dr. New knows more about.
Yes, I think if you're referring to the question of therapeutics, definitely, I think we all know the old saying that, an ounce of prevention is worth a pound of cure. And so certainly, as Minister Duclos has said, we've done well with our vaccines in terms of both our procurement and obviously the rollout across the provinces and territories. But we always know that, a certain proportion of the population will be unvaccinated due to, a number of circumstances. And even in those who are vaccinated, we're seeing some breakthrough infections. And so it's always important to look at what's out there in terms of therapeutics, in terms of treating those who do become infected. At the present time, we have quite a number of what we call therapeutics, monoclonal antibodies, and so on, that are being used more in the hospital setting to treat severe cases of illness, from COVID-19. And they're being used, obviously, by the specialists and in sort of certain circumstances. But what's very promising on the horizon is the fact that there are a number of what we call oral sort of therapeutics, which can be taken sort of out of the hospital setting, which doesn't require the same kind of, expertise because of intravenous administration and so on. So things are looking well. The government of Canada is in sort of advanced stages of discussions with, at this point, two companies, Merck and Pfizer, in terms of what we call advanced purchase agreements. But obviously, at the same time, for Merck, I understand there's a rolling submission that's still sort of being looked at by Health Canada, and we anticipate a similar submission from Pfizer, in the coming days and or weeks. So that's what's going on. And obviously, Health Canada will do what they need to do in looking at the clinical trial data to look at the efficacy results from the trials, and then obviously make a regulatory decision, and obviously look at the indications based on the data they receive. What we're also doing, though, then, is that we're looking at having consultations both with, I would say, the clinical experts across Canada, but also with the public health experts in terms of should these therapeutics become available, how would they best be used in sort of in a practical setting in terms of implementation. So all I can say is at this point things are looking promising in both sort of the regulatory process, but also in terms of the planning and thinking about how these types of therapeutics could be best used in the provinces and territories once they become available. Thank you.
Hi, David Thurton, CBC News. Thanks for taking our questions. Can you just clarify for me, when do these measures, particularly testing, when does that kick into place, so into gear here? If I heard you correctly, it's today. If so, what time today will travelers arriving into Canada have to do the testing? And what impact does this have on people who are coming from the US, either transiting through? Because, of course, that has been a backdoor for people to come into the country too, and there have been concerns about testing at that border too.
I'll try to answer the three questions, although some of these would be more in the domain of my colleagues. First, on the matter that Minister Alghabra mentioned when he spoke about when the requirement for people coming to Canada, having spent time in the last 14 days in those 10 countries, the requirement for those people to be tested at their last country, before entering into Canada, that was going to take effect tonight. Now, the second thing about orders in council or orders is about the inclusion of the 3 new countries in the set of 10 for those for banning any foreign national having traveled through these 10 countries in the last 14 days, and asking all Canadians that have traveled in these places in the last 14 days to be tested and to wait for their test result. So that those requirements will be put into an order in council, which will most likely apply tomorrow. So in a few hours from now. And for the testing procedures, testing vaccinated and unvaccinated air travelers entering into Canada. That will be done as quickly and as much as possible over the next few days. Now, obviously, no, that can't take place immediately everywhere at the same speed, but we have full confidence in the system, and in particular in our collaboration with provinces and territories, because some of these testing procedures, testing events, and then the follow-up with quarantine, some of that and sometimes much of that require the collaboration, the participation of provinces and territories. But we believe and we have full confidence that this is going to unroll quickly over the next few days.
So I just want to follow up on that. So how soon, or what is the latest that we could see this implementation of testing? And it's only at airports, from what I understand. And will travelers have to pay for this test, or will the government pay for it?
Well, let me give you a number. We are currently, across the entire set of entry points in Canada, both through land and through air, we're currently delivering about 20,000 tests per day. And we need to move to about 32,000 tests per day to be able to do what we already do, including randomly testing those that come through the land border. But let's remember that land travelers are either they are tested necessarily if they come unvaccinated, or they are tested randomly, about a quarter of them if they travel to Canada at this particular time. So we'll move from 20,000 to about 32,000, which is a significant increase, and that's why it's going to take a little while for that to happen.
Just, I'm sorry, Chris, I know you were next, but your outlet got a question, so we're going to get other outlets who didn't ask a question to ask questions.
CTV. I was the only one in line, CTV, so CTV
Let's
goes,
go CTV, then Le Devoir, and then the phone lines.
You came up after me, so.
And the ministers have a hard stop at 5:08, so CTV.
Discuss later.
Hi, Jordan Gowling, CTV News. My first question is your government considering a blanket travel ban, as Israel has done? I mean, is really this piecemeal approach of banning certain countries really going to be effective, given that this variant is now in Britain, Netherlands, and elsewhere?
Well, the first thing I want to say in response to that question is that the government will never hesitate to put in place the protections that are necessary to protect Canadians from the virus. That includes putting in place the travel restrictions, including those who are transiting through the listed countries, 3 of which we are adding to today. It includes making sure that we have the necessary testing regime. It includes making sure that we have as a baseline of protection vaccinations, which is the first and best line of defense against the virus. So we have never hesitated to follow the advice that we're getting from our public health care officials, which we continue to receive in real time, particularly with the advent of this variant of concern. And we believe that that the measures that we have in place are appropriate. We know that the Canadians are going to watch this very closely, as are we, and we'll take whatever decisions are necessary.
And just to go back to NACI recommendations on boosters, Minister Duclos, can you give us a specific timeline on that? And should provinces even be waiting around for these recommendations, given that the U.S. and the CDC have acted very quickly on moving that out?
Okay. Well, there are 2 reasons to ask NACI to do this quickly. By the way, this is an independent committee, and we're not going to force any experts to provide advice which they find is too early for them to provide. So the 2 reasons are, A, that there is a growing interest among Canadians from different provinces and territories in this particular issue. Christmas is coming. Many Canadians have been vaccinated now by close to 6 months, in some cases more than 6 months, and they hear that outside of the country, and some of them that you've quoted, the use of boosters has been more widely available. So they are curious, and they would like to know from the federal government what the federal experts think about the use of boosters overall. across Canada. The second reason is obviously the advent of this variant, which is a source of concern, not a source of panic, a source of concern. And in that context, NACI may want to consider a precaution within the current environment as one more reason to renew and revise its advice.
Thank you.
Bonjour Boris, pour Le Devoir, je voulais savoir.
A question from Le Devoir. Question. It wasn't quite clear, perhaps, for Canadian travelers. I understand that for all those coming back to the country through air, there will be a test at the border, except those coming in from the U.S. What's happening with the quarantine? There was a quarantine requirement at one point in a secure location or at home. Will there be none of that? Or could you please explain what Canadians can expect? Answer. It's 2 plus 2. Those two are the U.S. and not the U.S. So today's measures announced today apply to those coming from countries outside of the U.S., elsewhere from the U.S. The other two are vaccinated and unvaccinated. The measures that apply to unvaccinated people are the same. They've been the same for a while. Those who arrive through various means in the country must be tested on day 1 when they arrive at the border, on day 8, and continue their quarantine for 14 days. That's the 2 plus 2. Now, what's going to change today is that for vaccinated travelers who arrive at Canadian airports from countries other than the U.S., currently, those travelers don't always need to be tested and do not necessarily need to be tested. Even if they do take a test, they will have to start taking tests and be in isolation while awaiting the results.
So you've got the United States and the rest of the world. So what we are focusing on today is measures for people coming from the rest of the world, including the United States. Now, the other two is vaccinated, unvaccinated. The rules around those that are not vaccinated are not changing today. No, it's the same rules apply. When someone comes into Canada with a right of entry, that person needs to be tested at the land or at the airport, and that person needs to quarantine for 14 days and need to be tested once more on day 8. What changes today is the rule for those that are vaccinated coming into an airport in Canada. Those people will need to be tested on arrival at the airport and isolate and wait until their test result is known before exiting their isolation period.
Merci. Ma question de suivi sont pour.
My follow-up question, this is for the public health doctors. I'd like to know how many cases of the Omicron variant have been found in Canada and whether the measures announced by the government are enough for you or if you'd rather have more. Are you reassured regarding the measures announced for the Omicron variant? Answer. Hello, this is Dr. New. Perhaps I could start and Dr. Tam could add her information. We've seen 4 cases from Ontario and a first case in Quebec of the Omicron variant. Honestly, I don't know what is going to happen in Alberta. There's a time difference, but they're looking into one of the cases. So there may be up to 6 cases to date. We are expecting that there may be other cases because with our good monitoring system now and our labs, which are very well equipped to do sequencing and other work required to identify the Omicron variant, that work can be done. So that's one thing. For the second question, if I understood correctly, Dr. Tam and I and others always provide our recommendations, what the evidence is. So we provide that information, and with that information, Dr. Tam and I and others, all public health experts, also provide various options to the ministers. Of course, that information is confidential, but there are always a number of options presented. In the end, it is the ministers who decide which measures and decisions are to make. That's what I can tell you. But as I already stated, our border measures, as we can see, are measures to slow down the propagation of the virus, to gain time so that we can answer those three main questions regarding variants of concerns. So we'll adapt as time goes on based on what's necessary. Thank you.
Non, on va passer aux lignes téléphoniques.
We're going to move to the phone lines.
Just because
Chris,
I'm an
il y a des
English network.
règles à
There are rules that you need to follow, Chris.
So are people going to have to quarantine in quarantine hotels? Are they going to have to quarantine in their homes without other family members because we're getting into Christmas, the holidays? We're looking for clarity about the quarantine for the unvaxxed and vaccination. And that's just my question. I need that clarity, please.
Good, and I'll try to be clear. So what is called the designated quarantine facility, that's going to be used only for two types of travelers: those that come into Canada without a safe place to quarantine, and those that come to Canada from the 10 countries that we have signaled. The other travelers, in particular those that are vaccinated, Canadians that are vaccinated returning to Canada, don't need to go to a designated quarantine facility to wait for their day one test result.
Bon, alors, puisqu'on peut maintenant...
All right, Chris, we can move to the phone lines now. We have about 10 minutes left. So we will start with the first question. Please keep it short, both on the question and answer sides. Operator.
Thank you, merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. The first question is from Tonda McCharles from the Toronto Star. Please go ahead.
Yes, hi. Minister Duclos, I wonder if you could just clarify the testing requirement for air travelers arriving from non-U.S. countries. Do those people still have to do the 72-hour pre-departure PCR test in addition to the on-arrival test? And for the on-arrival test on day one, who pays for that, and and what is the cost of a test like that?
The answer is yes to your first question. They need to do a pre-departure test before arriving to Canada, and they need to do a day one test if they are vaccinated. If they're not vaccinated, as I said earlier, a day one test, a day 8 test, and a 14-day quarantine. Now, who pays for the arrival test? That's the federal government. It's always been like that, and it will continue to be so.
And can you speak to your thinking around why you've chosen to add 3 more countries when, and I think you addressed some of this in French, but when it's clear today that this variant has popped up in many other countries, Australia, Hong Kong, Belgium, well, you're banning Egypt because a traveler came through Egypt, but in Belgium, it's shown up there, right? So I'd like to understand why you feel that a more general travel suspension isn't in order.
For 2 reasons. The first one is that community transmission in the 10 countries, as Dr. New said earlier, is of concern, not only to Canada, but to our international partners. We were discussing that yesterday with the G7 health ministers. Now, the second reason, to explain part of your questions, is that we have double layers. Well, in fact, triple layers, because when someone travels, say, from a particular country to the UK before boarding to come to Canada, that person will first be subjected to UK rules for traveling, and then they will ask to show a pre-departure test in, say, London before boarding on a Canadian plane, and then when they arrive in Canada, they have another test, a day one test, to make sure that they don't have the vaccine and the variant. So that's because both of the strictness of our border measures, which is a level of strength that you rarely see in other countries. So we compare very favorably from the start of the crisis with all comparable countries when it comes to protecting the health and safety of Canadians because of our border measures. So it's because of that. It's also because of our geographical location. Now we have only one land border, and everyone else needs to enter by an airport. So because of that, we have this ability, this unique ability to have multiple layers of protection, which is sometimes more difficult for other countries.
Prochaine question au téléphone.
Next question over the telephone.
Thank you, merci. The next question is from Christy Kirkhope from the Globe and Mail. Please go ahead.
Hi, good afternoon. If there's any concern that perhaps Canada could end up on a travel ban list of another country, given the fact that we already have a number of confirmed cases here and there are investigations underway for several other cases.
Well, the good news about having a good system, as we have in Canada, is that we can identify the cases. So it's perhaps a bit strange to say so, but when we detect and communicate the presence of cases in Canada, that's good, because it just says that our public health system works. And the fact that we were able to identify those cases of travelers not long after they have landed into Canada, that's a great testimony to the fact that our public health system, both at the federal and provincial levels, work as they should. Nothing is never perfect. As Dr. Tam might want to say in a moment, there will be most likely community transmission of the new variant at some point in Canada. We see no evidence of this now because, as I said, we have been able to detect the cases of those travelers because of our border and other public health measures. Dr. Tam, would you want to add to that?
Yes, thank you for that question. And maybe just also partly answer what Tonda McCharles had asked before as well. So we use different criteria for flagging countries of concern. So the 3 additional countries that we're adding today, they have not yet reported Omicron variant in their own country prior to other countries reporting importations from those countries. So including Belgium, Israel, Hong Kong, South Korea, and now Canada, who've detected cases before the country of origin has detected cases. And this tells us that there may be some uncertainty in the country's overall epidemiologic situation and their ability to detect and respond. These countries also have very low vaccine coverage. And as I've said, exported cases, and they have not yet reported themselves. Another parameter we've looked at is our positivity rate on arrival in Canada. So we have this post-arrival testing, and from that, we could detect that there's been a rise in positivity rate, for example, from Egypt and from Nigeria. And indeed, we now have confirmed Omicron cases. All of our cases reported so far have been from Nigeria. And then the volume of travelers into Canada. So these are the several criteria that we use to pay particular attention to certain countries.
A follow-up?
Yes, thank you. I'm wondering, how is it ethical to be talking today about potential booster shots for healthy Canadians, given the fact that experts are decrying so-called inoculation hoarding by Western countries?
I may take this question. Well, we know that this pandemic is going to end only when it ends globally. And that's why we must obviously look after the health and safety of Canadians, but we also must be supporting other countries, especially those that are less developed and have certainly a public health system that is less developed. And this, and I believe Dr. Tam has been very active and influential in explaining why and how we need to do this. This is what we've done ever since we started the pandemic. So we are among any other comparable country, among the world leaders when it comes to supporting the distribution of vaccine doses through COVAX, to which we are one of the top contributors. We have also signaled, the Prime Minister has also said that we will be distributing 200 million doses over the next year. Many of these doses have already started to be sent, but we also have an additional channel through which we want to help those mostly developing countries through direct assistance for them to have the technology and the human resources necessary to actually administer those doses in an efficient and equitable manner within their country. So I recognize, and we all recognize, that this is a double challenge, but I think Canada is quite good compared certainly to many other countries in addressing that dual challenge.
Merci beaucoup. On a temps pour une...
Thank you very much. We have the time for one last question. Operator?
The next question is from Laura Osman from the Canadian Press. Please go ahead.
Thank you. I just wanted to build on Christy's question because the WHO has specifically asked countries not to vaccinate healthy adults, not to give them boosters when high-risk people in countries with much lower vaccine coverage are still struggling. What is your response to that? How do we justify that?
Well, as I just tried to explain, we are doing this now. Now we started that many months ago, sending doses either through COVAX, either in kind doses or through financial arrangements with COVAX, or either through bilateral arrangements directly with some of the countries. And we have increased our development assistance significantly because of COVID-19 in order to provide the human resource and technological resources that countries around the world need and expect to be able to do their vaccine administration.
Thank you. I also wanted to ask, because obviously Omicron is already in Canada, you're going to be speaking with the provinces and territories this evening. Do you think there will be any discussion of domestic measures to try to quash the spread of this new variant?
I'm sure there will be, because we are all working for the same people and for the same objectives of protecting their health and safety. And as we know now public health measures and vaccination are the key measures to protecting our health and safety.
Merci beaucoup. C'est ce qui met...
Thank you very much. This is the end of the press conference. Thank you, ministers.